Remote healthcare consultations, a structured approach. There has been a shift towards remote consultations as the new routine for outpatient medicine. Various recommendations from different governing bodies, including NHS England, the GMC and the BMA, have recently become available and provide guidance on how to perform remote consultations. This virtual presentation aims to provide a structured approach to the practical aspects of conducting a remote consultation. So how do we conduct remote consultations? Whilst there are many similarities to face-to-face consultations, there are a number of key differences that need to be taken into account as we move to telemedicine as the new routine. The next few slides will go through how to do this. Firstly, arranging the consultation. Patients should be risk stratified to prioritise the timing of their appointment and assess whether it's clinically appropriate for them to undergo a remote consultation. Following this, administrators need to call the patient, firstly to arrange the appointment slot. Ideally, this should be over a 1 to 2 hour window. This is also a useful opportunity to screen patients' need for any additional time or assistance, particularly focusing on elderly or vulnerable patients who may struggle with the technology. During this call, patients should be asked whether they would like to be joined by a relative or a carer for the remote consultation. Following the confirmation of the appointment, the patient needs to be sent a letter or an email with the appointment date and time, as well as ideally a patient guide to remote consultations. It is also worth sending a pre-call questionnaire, for example an IPSS questionnaire, which might aid the future remote consultation. So now moving to on the day. Prior to starting any virtual clinic, you want to make sure that everything is in check. You should have access to the patient's records. You need to check that all the equipment is in order, particularly the sound and or video quality. Make sure you have a backup plan, just in case the technology fails. Currently, there's been an increasing trend towards video consultations and virtual platforms, so it's always useful to have the patient's telephone number in case all else fails. And finally, ensure that you're in an appropriate environment that will avoid disturbances and maintain patient confidentiality. You should start the consultation by making sure that the patient can hear and or see you. Introduce yourself and all other staff present. Confirm the patient's identification. This should include their full name, their date of birth, and potentially their address. Also ask the patient to introduce anyone else who may be included in the consultation, for example, any relative or carer. Then go on to explain how the consultation will work and the time that's been allocated. It is also important to explain why you have proceeded with a remote consultation and any relevant limitations that may be associated when comparing to previous face-to-face consultations. Confirm with the patient that the consultation is confidential and advise them to be somewhere private. Gain verbal consent to proceed with the remote consultation, and once this is all done, commence the appointment. There are several barriers to communication when performing remote consultations, and therefore emphasis should be put on certain skills. Use active listening, either through verbal acknowledgements or body language when using video consultations. Try to pick up on patient cues. If using video consultations, try to maintain eye contact. This doesn't necessarily mean staring at the camera, but at least look at the screen to show that you're engaged. It's also important to inform the patient when you are otherwise occupied, such as when taking notes or looking up results. Make sure to ignore any pop-ups on your device. And finally, it's important to summarise key points regularly to ensure that you compensate for any glitches in communication. And now moving on to closing the consultation. Again, it's important to summarise the agreed actions, including the patient's understanding and the timescales associated. Offer opportunities to ask questions or clarify any diagnosis, investigations or management discussed. Advise the patient that they will receive a letter documenting their consultation, with a copy also going to their GP. Confirm and record if the patient is happy to undergo any further remote consultations, and then end the consultation. This should be done by explaining that you are ending the consultation, then say goodbye. Allow the patient to also say goodbye or ask any final questions before actually closing the connection. After finishing the call or video, it's important to apply the same principles that you would to any face-to-face consultation. The patient's records should be updated. Any referrals, investigations, or treatments, including prescriptions, should be actioned. Importantly, if any patient requires a face-to-face consultation, this should be arranged in a clinically appropriate time frame. As previously mentioned, a prompt follow-up letter should be sent to the patient, summarising the call and any future management plan. Regular feedback questionnaires for both patients and staff are helpful tools to ensure improvements are being made to optimise this expanding service. So to summarise, as the NHS adapts, clinical practice will see remote consultations as a new routine for outpatient medicine. To help aid this transition, it's important to maintain a structured approach to these consultations. As the service expands, it's imperative that clinicians continue to maintain the GMC's core practice principles and work within their competencies.